All right, so welcome everybody to Mutual Aid and Organizing COVID-19 Infection Control for the People, presented by Mutual Aid LA, Network LA. We're gonna get right started. We are recording, folks, so if you miss anything or like you need to step away, totally do that. Just wanna let folks know. This is our agenda. We're doing some intros. We're gonna get into housekeeping. We'll move on to a land acknowledgement. We're gonna do some community agreements. And then we're gonna get into the meat and potatoes of this, and it's gonna be the Ground Game LA kind of incubation and how it morphed into an independent project of Mutual Aid LA Network. Then we're gonna do Q&A, and then we're gonna close. Ideally, what I would like to see happen is the first 5 items of this are going to be an hour, and then we're going to get to your questions around what you're bringing to the table and what your burning questions are. Okay. All right. So I'm Wendy. I'm the infection control and medic team. I am also a trainer, a community organizer, and a vet. That's kind of where I get my medical foundations from. The password is 1312. 1312. All cops are bastards. 1312. Thank you. All right. Yeah. So there we go. I'd like to introduce to Dr. Ron Birnbaum. He's over here in the chat. You will notice him. He's our advisory medical consultant. He's also a community physician and an activist, as well as a Navy vet. So there's some rivalry there with me and him, but I think we'll get along just fine. Yes. And I'd also like to introduce Brandon Crowder. He's on the tech 1s and 2s. So if you have any tech questions, any tech issues, please reach out to him. He's on the tech 1 and 2s. And I'd like to introduce the rest of the team. Kendall's on here. Kendall, you want to introduce yourself?
Sure. Hi, I'm Kendall. I'm with Ground Game LA and have been part of developing the Mutual Aid project. And I'm also currently in medic training with Wendy to be a community medic and train other community medics. Very excited to be here.
Fantastic. Thank you, Kendall. Kendall will also help me with do some support with facilitation and chat. So next up is Tim. Tim, would you like to introduce yourself?
Hi, my name's Tim, generally run with they, them pronouns. I'm an organizer with Ground Game Los Angeles and Power, and I'm one of the inventory office leads, trained under Wendy, and also training as a community medic in her program and helping support her in this.
Yes. Kylie, you're up.
Hi guys, I'm Kylie, she, her pronouns. I am a field manager of Nithya Raman's City Council campaign, and I am one of the inventory leads for the Mutual Aid work here in LA. I'm also in Wendy's street medic training.
Awesome. Andy, do you want to introduce yourself?
Hi, I'm Andy P. They, them pronouns, please. And yeah, I'm in the medic training program. I also do medic trainings for DSA. Yeah, very glad to be here.
Fantastic. Welcome, Walker.
Hey there, everybody. My name's Walker. I'm an organizer with Ground Game and Food and Water Action. I'm one of the co-leads on the inventory team at the Mutual Aid office. And a little unrelated, but currently studying pre-medicine. So really, really interested in all of this.
Fantastic. Thanks, Walker. Am I missing anybody? Doesn't look like it. Let's take a look. Oh, here we go. Okay, fantastic. Yeah, we're getting there. We're getting there. Hang tight for me. All right, cool. So really quick, I want folks to introduce themselves in the chat. Your name, your pronouns, and your affiliated organizations. If you don't have any organizations, that's totally fine. Go ahead and Just put independent. You don't need to put anything if you don't want to, and then your location. Where are you at? Go ahead and drop those. Fantastic. Awesome, awesome. Everybody welcome. Eric, Daniel, Natalie, Paula, Reed, Ken, Brooke. Yes, beautiful, 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 beautiful. Welcome, folks. Welcome, everybody. Fantastic. This looks great. Kendall, I'm going to count on you to keep me honest with the chat. So I'm going to not have the chat open here on my share. All right, folks, we're going to move on to, let's see what's happening here. Ah, perfect. Housekeeping. If you agree with the point, go ahead and put the positive in the chat. If you want to get on stack, like say you have a question, this is mainly for our co-presenters, Dr. Ron, Kendall, Tim, Kylie, go ahead and get on the stack. Try to keep your questions, points, comments concise, succinct, and direct. We have a lot of ground to cover today, like I said, and I really want to get to the meat and potatoes of your questions and like what you need in the community. Let's see here. All right. Woo. No, how do I go back? Sorry, folks. Ay, Dios mío. Okay, hang on tight. There we go. Woo, the share screen thing is interesting. Okay, if you have comments, if you have additional resources, drop them in the chat. Use that. And just keep in mind that your questions, I have put them at the question and answer portion that when you registered. So we're gonna get to those. And then Kendall's gonna let me know if you have like a specific question that relates to this, you can put it in the chat too, and we can address that right then and there. All right, wonderful. So now that that's out of the way, how does that sound good for everybody in terms of good housekeeping? All right, double check the chat. Fantastic, wonderful. Awesome, awesome, awesome. Cool. And Kendall, like, feel free to like interrupt me, of course, and just jump in. So here we go. I'm gonna level with you good folks. I'm not an expert on land acknowledgements. I only very late in my organizing years started this practice and started leaning into it. So I look at it as an opportunity to honor the land we stand on, its original stewards and peoples, as well as the very real reminder of our connection to the land or the lack thereof, right? So that being said, I recognize that I'm standing on and occupy unceded Tongva land, more popularly known as Los Angeles. So this is a reminder that most of us are uninvited guests here. Some are colonizers, and we need to recognize that legacy and its effects on the original peoples here and the land. So I invite you to drop in the chat if you know the original stewards of the land that you are occupying, that you are standing on, that you take from, go ahead and put it in the chat. If you don't know, I invite you to think about why that is and lean into finding out, right? Like, where are you living? Whom does that land belong to originally? Who are its original stewards? And importantly, Native people, Indigenous peoples are still alive, are still around, are still struggling, and are still seeking collective liberation. So this also brings up the question of visibility, right? So in my opinion, no land acknowledgement is complete without action. So that's that's one of the main principles. So we can't just talk about it, we also got to be about it, right? So praxis, praxis, praxis. So go ahead and keep dropping that in the chat. I'm very interested to see what that looks like.
Wendy, I think this might be a good time to invite Lydia if Lydia wants to add anything to the land acknowledgement.
Yes, please. Absolutely.
Many blessings, relatives. It's nice to have everyone here, and I'm hoping that you move this vital information forward. We acknowledge that these are indeed unceded lands, Tongva, Chumash, Tataviam, and Hachiman, and Tongva, wherever you are, north, south, west, and east. Thank you so much, Wendy, for that beautiful land acknowledgement. Many blessings, everyone.
Thank you so much, Lydia. Yes. Thank you, Kendall, for that. All right. So I'm going to dedicate this workshop, this /webinar, and ask folks that that they donate what they can. A good starting point is the indigenousmutualaid.org. They have a directory there, and they can contribute, and you can take it from there as it applies to your region or city or area. That is the homework for this webinar leaving here. Okay, so you can also do some digging around on who your local organizations are and throw down some funds, especially if you're a person of privilege. We're talking about white, able-bodied, hetero, cis dudes. As close to that as you are or are, I invite you to go ahead and do that. I want you to keep in mind that I recently had a call on infection control precisely with Indian country organizers. And one of them told me that they do not have access to running water, right, where he's at. It stunned me, but also, like, after the fact, I was like, oh shit, like, how do you decontaminate? How do you do any of the things, right, without running water? It's vital. So it's a major, major challenge. Keep that in mind. Okay, folks. So now we're going to move to community agreements. I think a lot of folks are, mostly familiar with these coming from organizing like mutual aid. So I'm going to move through these rather quickly. First of all, community agreements are what we all agree to, right? To stay as like principles and guiding in our conversation and as we move through this webinar, through this workshop. First and foremost, what happens here stays here, right? What is learned here leaves here. That's pretty much self-explanatory, right? We want to protect people's privacy and anonymity when they're sharing sensitive information. This is a space of trust, and we want to foster that, and that's an active thing, right? It doesn't just happen. Be present, right? I'm going to throw a lot at you today. Like I said, I'm covering a lot. And so I want to make sure that folks are getting it because we don't have a lot of time to repeat or like go back or do a lot of the things that I would really ideally like takes years to get into, right? And be engaged. Leave the phone, leave all the other things, right? That goes with the being present. And step up, step back. What does that mean? That means like acknowledging your privilege, but also knowing like how much time you're taking and being self-aware of that, right? Like, am I talking too much? Like, that's just me in my head too, but like, am I taking up so much space that like others cannot take up space, right? That others are not being heard or don't have the space to step up. Are there any questions on that so far in terms of community agreements?
I just wanted to offer that I put this in the chat, but if anybody wants to raise anything anonymously and you feel comfortable, you're welcome to message me privately in the chat and I'll bring it up. Or if you have any concerns, feel free to use that private feature and I will do my best.
Yes, thank you so much, Kendall. Would anyone folks like to add to the agreements? Type it in the chat for me, please, and Kendall will be so kind. We good to go? All right, everybody consents to these community agreements? Are there any objections? Kendall, we good?
Emily says share squared is a non-ableist form of step up, etc. Share yourself, share the floor.
I like it.
Some better language that we can use for that agreement.
Yeah, I like it. Share square.
Share squared.
Share squared. Got it.
Or share yourself or share the floor.
Awesome.
We got a lot of pluses in the chat, so I think
Awesome.
we're good.
All right, so we're gonna move it along then, barring any any objections, period. Wonderful. All right, so let's get into it. First and foremost, what do you need for infection control? Safety, 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 safety. Yeah, and oh yeah, safety. I really cannot stress this enough. Safety for ourselves and safety for others. Because what do we call a sick organizer? They're no longer an organizer, right? I mean, they are, but you know what I mean. And what do we call a sick medic? They're no longer a medic, right? So it's very important that we practice safety all of the time, 100% of the time, all the time. And to that end, I'm gonna have Brandon drop the link for his really awesome scene that helped us a lot as we started to get our mutual aid efforts off the ground. So Brandon, go ahead and drop that when you get a chance, please. I highly recommend it, bookmark it, love it, read it again and read it again and read it again and read it again. All right, so what does that mean in terms, what does that look like in terms of like what you actually need to be safe, right? Or to practice as much safety as possible. This is just a really quick list. Hats and hairnets, reusable cloth mask, preferably with a place to insert an additional filter like a paper napkin that you will change on the daily, that you will also clean on the daily. N95 surgical masks. If you're not doing medical care, that's really not needed, right? So hopefully you can have some nice reusable cloth masks. The more barriers, the better, right? Reusable gloves, preferably kitchen or industrial type, right? That you're going to be reusing and reusing, can withstand a lot of usage. Buckets, rags, bleach, and a measuring jar, a pitcher. We'll get into why later. Soap, plastic reusable paper bags, shelving, tables, bins, printer, paper, and clean running water, right? It goes without saying, like, clean running water. Am I missing anything on that, folks, in terms of like the list? Tim, Kylie, Walker, Ron? Okay, cool. All right, moving on. Number two, principle number two, do no harm, right? So we're all likely here because we want to do good. We want to support our communities. We want to fill the gaps. We want to be there for others. And that's great, right? That's admirable. At the same time, because of the crisis that we're living in, there is a great risk of causing harm to ourselves and others. So we have to keep this in the forefront at all times. Do no harm, right? There is no cutting corners. Okay, number three, we either do it right or we don't do it at all. That's been my stance since the beginning of this. That's the rule in my book. If you're not willing to commit to doing things right 100% of the time, every time, I strongly recommend you stay home. All right, don't do mutual aid, don't organize. That's the standard. Why? Because the risk outweighs the benefit, right? We gotta get it right, and we gotta get it right every time. The stakes are entirely way too damn high. Yeah, so this, I know like it may be rough for some folks to hear, but I refer to rule number one, safety, 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 right? So we gotta be disciplined about it and we gotta be serious about it. It all goes hand in hand. This is literally life and death for folks. And I imagine no one here like wants to be responsible for spreading the virus, right? Like that's my assumption going into this, and I hope that's your assumption too and your belief. All right. Cool. So a proper infection control system is infallible, right? Humans are not. So like you can have the perfect system in place, but if folks are not following the systems and doing the things, then it doesn't work, right? So you have to have consistent attention and detail, and you have to utilize all of them, and you have to apply them, and you got to use the systems properly, right? Because otherwise it's just pointless. So really I want to drive this point home that like humans are the main variable here. Yeah. All right, so number 5, this one's pretty self-explanatory. You're gonna need a team, right? Whether that's 2, 3, 4, 5 people, you're gonna need accountability, meaning folks need to be able to say like, hey, you missed the spot, or hey, like there's a better way to do, I think there's a better way to do this, very early in the process, right? And I'll get into like how that played out with us a little bit. But very early in the process, like a comrade challenged me to think about like, no, like this cannot be it. This is not the only thing that we can do, right? In terms of like when I was thinking these systems through. And it worked out. Like it turned out like her challenge made me go look at things, right? And research and dig deeper. So the systems are better because of it. And we got to remember that like this is a brain trust, right? No one person is the holder of all of the knowledge. That being said, like attention and detail is super key. The more anal, the better, the more OCD, the better, the more, you know, just on detail, right? Order and flow, right? The entire thing has to have a flow and it has to make sense. And this is obviously going to vary in terms of like a case by case basis, right? Like I'm going to show you what ours looks like, right? But obviously that's moldable to how you're living in your life and the needs that you're trying to meet. And then feedback, right? Feedback is incredibly important. We have to be able to have iterative processes and be able to tweak them when our communities say, this is what we need, right? Or you're doing things wrong, right? Or you could do better here. Communities are the leads, right? And that ties into the flexibility piece of it. Discipline, right? I've been saying this a lot, it ties in, but it's worth repeating, from the way we do things to like the way we show up in communities. The consistency has to be there, right? Like you can't do outreach and then just disappear the next week, right? You can't deliver and then when folks call again, you're not there again, right? So sustainability is gonna be a huge piece of this. Cool, I'm gonna pause right there. Would any of my comrades like to add anything thus far? Cool. Any questions on the last 5 points in general for folks?
Wendy, could I make, I might call it a counterpoint on the cutting corners thing. So like, I agree that you don't want to hurt people. And so you need to take the kind of work you're describing seriously. And, but here's the but. Every interaction, there's no such thing as a risk-free interaction either. So that for people maybe who, well, there's another model to consider, which is like the safer sex model, right? Which is that you have 100% mindfulness about safety every time, aware that some things are not perfect, and that doesn't totally stop you from acting, but that so I don't think that's a cutting of a corner, but I think it's an acknowledgement of that without, with any interaction, there's risk. And that doesn't make it not worth doing.
Thank you. Yeah, that's a great point. Totally valid. Absolutely. Does anyone else want to jump in?
Yeah, to Dr. Birnbaum's point, I think what's helpful in that is like taking things on a case-by-case basis and taking into consideration the community that's involved in the effort and what the risks are and what the need is, and making that assessment like as a community and as a team, right? Like what are we willing to, what are we willing to do in this particular circumstance and with these particular constraints? What feels like the right way forward, and like making that decision as a community whenever possible. But obviously in an emergency situation, you have to make those decisions right away.
Yep.
Kathleen also raised self-care in the chat.
Yes, wonderful. That's absolutely true. And I would also add community care. I think, I can get on my soapbox about this, but I think we put a lot of the care on individual folks, and we also don't, replicate the community care piece, right? Or maybe it's not as explicit, right? That's just been my experience, that it falls on like women of color to like care for folks. So I would, yeah, absolutely. I think thank you for raising that.
We also have Andrew in the stack. Andy?
Yeah, I was just gonna say that even if our protocols, when they come into contact with humans, don't result in 100% secure things, stopping 99% of cases will still save hundreds or thousands of lives in this pandemic. So keep every single time, it is safety, 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 even if errors get made.
Yes. Absolutely. Yeah. And I probably should have been clear about that. I am always striving for 100%, like zero risk, right? Like doing it perfect every time. That's my goal. That's how I move in the world. At the same time, what Dr. Ron has said and what Andy has said and what Kendall has said is absolutely true too, right? Like those things are not mutually exclusive, right? So that's, that we have to hold a lot of things at the same time with this. Anything else for folks? Okay. Did we get the zine link in the chat?
Yes, ma'am.
Awesome sauce. Thank you so much. All right. So the other thing is that was a good segue too, which is like get creative and get creative fast, right? So like we're living in very like unique times right now in our lifetime. And so it's so dire that like we shouldn't, right? And we cannot count on the status quo. But the moment also calls for us to be creative, right? To rise to the challenge, to figure things out, to make mistakes early on, fix them, and then get the systems right? So there's no one like particular way of doing things, which I think is part of what the team has spoken on. But the fundamental science, specifically microbiology and laws, remain the same, right? So we have that to our advantage. Also, like this is gonna look different for different folks, right? Like I saw someone on the registry list that they're looking for tools for a rural scenario, right? So this case, you could be able to pull from this to apply there, but obviously it's not going to look exactly like we're doing here, right? The density is not there. Some folks don't have access to running water, maybe not even bleach or disinfectants, right? Or office space, right? There's also another person on the registry that like is trying to do this, basically by themselves, right? So like maybe you don't have the comrades, that needs to be built out, or you need to link up with folks, right? So the goals and principles will look different for folks per their area. But a lot of this should remain the same in terms of like the science and the fundamental laws, right? All right. So number 7, there is a lot that we don't know, right? Because we need to remember that this is an ongoing and developing situation, right? We don't have the benefit or the luxury of looking back into time, into peer review studies or lived experience, right, through this, right? So anyone who tells you like they have all the answers is likely lying, right? We don't have that luxury and we don't have that benefit right now. of reaching back, unfortunately, of community study, of lived experience through this one specific COVID-19, right? And this has very real implications on our very first principle, which is safety. So that means several things. One, that means that we have to consistently be doing research and stay up to date. Two is the point that I made earlier, which is that we need to have a brain trust, right? We need to rely on our comrades to have eyes and ears on like a variety of fields, right? And not work in silos, which is why I have such a huge team today. And that's just really like been a practice for us. So keep that in mind. And then this is just another way of putting it, because I really like want to drive this point home. All right, but the good news is we do have the fundamentals, right? And they're immutable. And we can also, like I said previously, like rely on our creativity, rely on ancestral knowledge, rely on resiliency. Indigenous peoples and people of color in particular have survived and made it this far, right? And as such, like we didn't only come this far to only make it this far. So let's be honest and real about like what we don't know, and be ready to be challenged, and be uncomfortable and be wrong. And importantly, be ready to like collaborate and work together, right? So that folks can like cover the gaps that I personally don't have, that other folks don't have, right? Anything from my team thus far? Any general questions? Well, anything, questions from folks thus far? I think I see the message.
Carla in the chat is asking for an example, but Carla, can you clarify what you an example of what?
Oh, just an example of this in practice, like what has been a known but unknown and is, yeah, I don't know, just would love to just hear more.
That's a great question. So early on, we didn't know, and really like this is subject to like change, right? We didn't know how long this thing lives on materials, right? How long does it live on plastics? How long does it live on paper? How long does it live, right? And to that end, like we need to know its lifespan so that we can lower the risk, right? And we don't spread it to people. So early on, when this thing was starting here in LA, really hitting in LA, which for us was like March, somewhere in March 11th or 13th or something like that. We were really challenged with like finding out those answers, right? And figuring out like what don't we know? How long does this thing live? And then from that, researching as much as possible and sharing information with other folks and leaning into other folks to be like, you know, and this was me also too consulting with like Ron about like, Doc, how long does this thing live? Like, what are, like, we need to know, right? Because there's things that you're going to be able to decontaminate actively, and then there's things that you're not going to be able to decontaminate. And that's passive decontamination. And so you need to have a framework of what that looks like. But, right, because this is a developing and evolving situation, this infection control for us didn't move forward until we had those answers. Like we couldn't, right? Responsibly, we just couldn't be like, oh, okay, well, we'll just guesstimate that it lives 24 hours on paper. So we'll just leave it 24 hours and keep it pushing. Like we in good conscience, I could not do that, right? Does that answer your question, Carla?
We also have Tim in the stack.
Yes, Tim, chime in.
Yeah, and just to kind of add on to this, just so you all have kind of an idea of issues that we're still working through, not just in mutual aid, but like as a society, is the rate of asymptomatic carriers. We still haven't dialed that in. And also the rate at which people have immunity to COVID, because we're finding that there can be reinfections. So this is really an ongoing process and one where we're always checking ourselves. Like you don't want to be complacent, because then that's going to lead to errors and to you like dropping the ball and perhaps reinfecting people, and also part of the constant call-in to have everyone on your team tested, to have yourself tested, perhaps more than once, because you don't know if you're carrying it without symptoms, and you don't want to be a vector.
Yeah, that's a great plug for everyone to sign up to get tested. That is available now. If you are in Los Angeles, that's obviously not everybody on the call, but if you are in Los Angeles, you can sign up to get tested. Oh, they're currently out of tests, Madeline?
Damn, that was fast.
Well, oh, test slots. They're out of test slots. Okay, well, keep your eyes peeled for when that gets reopened, because like Tim was saying, that is a really important part of collecting that information so that we can, you know, expand our knowledge and our understanding.
Yes.
Can I share a personal anecdote related to this?
Yes, please.
So, and to do that, can I share an image, screen share a thing from my
Yeah.
deck?
Yeah.
So, and everybody's point that you want to stay aware so that because there is new information coming out and some things are unknown. And then the other thing is the humility to question yourself and to question your own practices in light of new information is important. And so I'll just my own life is constantly humbling to me. So I'll share one experience related to this that maybe then other people can relate to. So I am involved, I'm a doctor, I'm involved in healthcare. But although right away, the places where I work aren't places that had N95s to begin with and weren't getting them. But a lot of people in the community, actually in the spirit of mutual aid, reach out to me to donate some N95s, which I deeply appreciated. And then what I mostly did was to transfer most of those to places where I thought there were maximal need. However, I do consider myself sort of at risk and at risk of harming others in my work, because I work in healthcare in multiple places. So I kept one mask for myself, and then tried to understand more about actually how to preserve that mask, which I could talk about, or how to decontaminate that mask. And while I know we don't want to emphasize the use of N95s for the public, just the anecdote I think you'll see is relevant. So this is this picture of my mask, and it's actually on one of my kind of steaming contraption, but ignore that for a second. Can you see that there's this filter thing on here? So, this is not a medical mask. This is one that's for people who work in industrial settings. And that little filter, it's not a filter, it's a one-way valve. And so what it does is if you breathe in, nothing comes in through there, but if you breathe out, you will breathe out air through there. That's because the purpose of that mask would be to protect, not to protect the world from you. Purpose of that mask is to protect you from the toxic stuff in your workplace. And it took me a while before I realized how then this was imperfect for the purpose. Do you understand? I thought I'm Mr. Smart Guy doctor, but I had to, so until I was confronted with the concept of source control, right? And so that when Wendy is talking about safety, she's hit it all in the different steps, but it's your safety, it's your client's safety, and it's the safety of the entire community. And you're thinking about all of those at the same time. So you might be safe, the person you're dealing with might be safe, maybe because you're low risk or whatever, but their 90-year-old grandparent who lives with them is the person who you're protecting, and you're not even seeing them. So keep sort of doubting yourself, doubting, questioning, asking, coming back. That's my point there.
Perfect. Yes, absolutely. All right. I'm gonna get back to my screen.
Is it time for questions for Dr. Ron, or should we hold on those?
Please hold on us. see. Okay, cool. So here we go. Pretty simple, avoid, stop, and correct cross-contamination. Can we define cross-contamination? Anyone on my team? Or just in general, folks? No one's bold enough. All right, so y'all have done this to some degree in the kitchen. Oh, is there a chat? Y'all have done this to some degree in the kitchen with chicken, right? Where you like prepare it and then you put it in like the boiling or whatever and you're in the thing and then you wash your hands, right? It's similar, it's that concept, but I'd say with more rigor and more clear demarcation of what's dirty and what's not, right? What's clean and what's hot. So to avoid cross-contamination, you got to keep your hands up, right? And I like to say that like you're either namasteing or you're praying or whatever, or like you're asking for alms, whatever your vibe is. But keep them up here when you're decontaminating or just like when you're in that general area, right? Prevent from touching other stuff. Don't touch your phone, right? Don't put them on your hips or like touch your face, right? Because then you're contaminated again, and you need to clean those gloves. And we'll get over like exactly how to do that here shortly. All right, so we're gonna get down to brass tacks here. Here you have a very rudimentary floor plan of our operations. Hashtag I am not an architect. I'll give you a minute to like take it all in and get your bearings. Okay, so this is the current layout of our decontamination inventory processes. The orange arrows are the hot flow. The green arrows are the clean flow. And we are assuming that everything that comes in is hot, unless decontaminated, right? Or passively decontaminated. And we'll get into that a little bit later. And in fact, like everything is hot, right? Everything is hot, everything is lava, especially the floor, especially like the things, everything, right? Which is why I consistently say like, keep your hands here, keep your hands up here, right? Be aware of where you have your hands. The lavender circles that you see, those are control areas. So like you'll see one over here on the lower left-hand corner. That's, you can only get into the building through a code. Then you'll see another one over here at the top where you near staging area. That's another code, that's another door into our office. And then you're gonna see importantly buckets of bleach and soap. Those are the blue. And you see also like where we wash our hands, which is the sink and the baths. And you can see kind of like the general flow of the goods, right? Now, importantly, in those bleach buckets, you're gonna have 10% bleach, 90% water, right? That's why you need the pitcher, you need to measure that out. That's good for 24 hours. So every day you need to change it. When you come in on shift, that's usually what we do. We toss the old stuff out and then we make a new batch for like everything else, right? And we also keep a bucket in the clean room for the purposes of just like cleaning the clean room, right? From the X over there, from the door where you see staging, only people who have been trained in infection control can go past that. And we usually keep it to like a 3 to 4 person in that general area, period, max. Like that's it, no more. The more folks, obviously.
Sorry, we've got Tim in the stack.
Yes, please, Tim.
Yeah, sorry, I just wanted to say we kind of, I'm going to turn my video on. I was eating dinner and didn't want to be rude. But we recently changed our policy a little bit where we are taking the bleach out at the end of the night, mainly because it does kind of smell up our building. And as it's getting hotter out there and depending on how climate controlled they are, some of that bleach will cook off into the air around you. So it's just something to be aware of because bleach can be kind of like hard on the system. So this is one of those things where like every morning, the first thing we do is fill those bleach buckets. And then the last thing we do after we wipe everything down is take that bleach out. But that's going to depend on the space that you're in and your comfort level. But also another reason why like N95 masks and stuff might be something you would possibly want to use, because breathing in bleach is not super comfortable for anyone.
Excellent. Thank you, Tim. Fantastic. So can either like Kylie or Walker walk us through like the flow of goods, like what happens?
Sure. I can hop in unless Kylie, you wanted to. Wendy, I love this map. It's really good to see it come back. It's been a while. It's been a couple weeks.
Baby.
So if you look at that purple X and you follow that first orange arrow up the stairs into the hallway to the other purple X in the staging room, that's essentially the pathway for people to come in from the street. We have donations that come in with some regularity, though I will say we've had quite a successful fundraising model, and we've started to realize with delivering goods to people, it's a lot more space efficient. It's a lot more time efficient when it comes to cleaning and packing, and even packing deliveries in cars if we go modular. So we've started sourcing most of our food in bulk from restaurant supply depots, either using people in our network who own restaurants or taco trucks or things like that, using their distributor license to buy bulk foods, or making several Costco runs. But whatever your situation is, we have a staging room where all hot items come in. That's the room with the pink S that says staging. When we're ready to clean those items, we move them into the inventory room. And note that I'm talking about items that we can reliably clean. Anything with clear surfaces that can be wiped down, not loose clothing, not like an open box of loose tea bags, nothing like that. Things that can be handled pretty quickly with bleach. They come into the inventory room, and then you'll notice that there's this blue rectangle between the inventory room and the clean room. That blue rectangle is actually a physical fixture. It's a wide Rubbermaid bin. Inside that bin are 2 5-gallon buckets. And in one of those buckets, we mix soap water. And in the other bucket, we mix a 10% bleach solution. So we use the bleach for just about everything that is not produce. And things that can get fully submerged into bleach, like cans, are. Things that need a bit more of a delicate touch and need a wipe down with a well-wrung rag, like cardboard items, that's how we do that. And then the soap water we use for all produce. We don't want to put produce in bleach, so we do put it in soap. Hopefully, some of the intermolecular forces that interact between soap and virus pull it off into the soap water. The important thing to note is, if you are going to be handling produce, we don't really have a way of rinsing the soap off. So all of our drivers are instructed multiple times to tell people to rinse their produce. Reason being, I don't know if you've ever eaten soap, but it will give you diarrhea depending on your sensitivity to it. And we do not want to be harming people in that specific way. So we do make sure that folks know that their produce probably has like dry soap on it when they're receiving it. Anything that cannot be cleaned, Wendy said earlier, we don't know how long this virus lives. So our best bet, we have multi-tiered storage shelves in all the windows of our office. We have southern facing walls, so we get a lot of sunlight during the day. And for all the items that we can't reliably clean, we just put in that sunlight. We don't actually send those items out to people because, again, we don't know. There are a lot of different anecdotal stories of investigators finding virus well after anyone thought they should have been able to find virus on surfaces, and we just don't want to contribute to that. That also means that in our intake process, we've started communicating heavily what donations we will accept. We don't accept clothing anymore because we just can't reliably store it on site. We can't clean it. We can't sort it. We don't accept loose items. So if you just have a weird Ziploc bag full of like oatmeal packets or tea or stuff like that, we don't take it. So we've had to become a lot more selecting. Yeah. So then let's step into the clean room. What's in the clean room? Everything that's been cleaned. Cleaning is a two-step process. You have one person who essentially is handing the hot item off to someone who's in the clean room. The person in the clean room's gloves are always sterile and should never be touching hot items directly. So those items are always handed to them once they've been cleaned properly in bleach. And that process, like if something can be submerged in bleach, it should. And if we can submerge a thing in bleach for a minute, we do. For everything else, it's a rag wipe down before it moves into the clean room. Our clean room is full of like 5-step shelves on every single wall. And when we set up our clean room, we bleach the floors, we bleach the walls, we built and bleached all of the shelving in the room. And Tim put together a basic numbering system for each shelf. So we have like a general layout of where we'll put things, even though we kind of figure it all out as we go. So whatever's like ergonomic to the moment, we do it. And then if you look back at the staging room, you'll notice that between the clean room and the staging room, there is another door. And in that station, nearest the clean room door in the staging room, we have a setup station. It's basically like a kitchen cart up against the wall. We bleach that every day, and then we wipe down the wall that's adjacent to it with bleach. And we have a 2-bagging system. So anything that's coming out of the clean room gets put into a brand new or a bleach processed Ziploc bag. That bag is then handed off into the delivery station and is put directly by the person in the clean room into a second bag, which is held open by someone in the staging room. And then we code those bags for delivery and seal them and then hand them off to drivers. No one besides the clean room person and the person receiving groceries ever touches the inner bag. And if that's a little confusing or hard to visualize, I guarantee you that whole process is laid out in the zine that was thrown into the chat earlier. So to keep us out of the weeds, I would just recommend reading that thing 10 times. But that's essentially it. Our operation on any given day only really needs 3 people in the office to staff, 2 people cleaning, 1 person running admin and general workflow and coordinating with our driver team. And then offsite, we have a logistician who coordinates all of our drivers via Slack and makes sure that we're not crowding our hallways, we're not crowding our office, and that people are only coming in when it's time to pick up deliveries. And then when drivers show up, I generally tell them to tell me what it is they're about to go do, so that if, let's say we instituted new techniques and they didn't get up on that training, we can sort that stuff out face-to-face right there. The other thing I'll mention, our unsung heroes are another team that we have called our needs team. And basically, when you enter our process, you fill out a Google form that lets us know what your needs are, whether it's services needs, medical needs, or grocery needs, hygiene needs. And our needs team basically goes through this monstrous spreadsheet, prioritizes people by their need, calls as many of them as they can, like caseworkers, and then bundles them together in deliveries that then make it into our workflow process. So it's really the congress of these 3 teams working together on any given day that gets all this work done. And beyond that, there are other teams that feed into that process that I don't need to detail here. And we do have people on needs team on the call if folks want to get in touch with that and learn what that process looks like. But that's kind of the external to internal workflow that I'm describing with those teams. And then Kylie, Tim, and Wendy, anything else you want to add? I'll shut up.
Let me raise a couple questions that came up in the chat. One was, is this available written out, like written steps, so that people could use that as a reference?
Yeah, so we're gonna get to that. And also I can make the infection control protocol available to you folks after this. You're gonna get the recording, you're gonna get the document, you're gonna get all that stuff.
Cool.
We're gonna overdo it a little bit here, yeah.
And then I just wanted to speak to, we were talking about clothing donations a little bit. So we're not equipped to take clothing donations, and part of that is because you need to have, basically you need to have like laundry services available to clean those and like disinfect clothing. But like somebody mentioned, Dottie mentioned in the chat, YMCAs are taking clothing donations. There are other organizations that are set up to take clothing donations. So that's where we've been sending ours. And I'm sure there are places around you that are probably doing the same. We don't have to do all the things, right? I think that's it for questions from the chat.
Cool.
So Karen and Wendy.
Thank you, Walker. Thank you, Kendall. That was awesome. Kylie, I just want to give an opportunity to the rest of the team to kind of like chime in on any of the gaps we might have missed. We will go into a little bit more of what Walker was talking about a little bit, but I want to hold space for folks.
Can I make one comment on all that?
Yes.
Which is that it's in my opinion like very well conceived, and like would reiterate my sort of plaudits to Wendy and the team there that put that together. I would say that it is like on the it's on the very safe side. In other words, it's like its margin of safety is very strong. And the reason I bring that up is it's a couple. So one is 10% bleach is pretty concentrated, and you should be careful too, because you can hurt some people with it. And some folks had mentioned that. But the other thing that I think people should know in general is that killing like a single-stranded RNA virus like the coronavirus, it's not that hard to do, but you do have to do it. So it is very vulnerable to all kinds of different ways of disinfecting. In fact, way more vulnerable than like the average bacteria that is like what people in medical settings are often worried about with like wound infections and things like that. So that, you know, like I will mention that even like the CDC has a like kind of a bleaching guideline for home disinfecting. And obviously they want to be like, make sure people aren't hurting themselves with bleach, but their percentage is a third of a cup in 5 gallons, which works out to like 0.4%, not 10%. And that's sort of like, it's stronger than swimming pool water, definitely, but it's not 10%. So I just want people to know that like, that one of the biggest things is that you try to do what, like the act of trying is very likely to be successful unless you're way off. So like your washing of like soap and water works very well, you know, so your washing of vegetables or whatever, yes, rinse them a lot so you don't leave soap behind, but it will work. Like you don't have to be like, oh no, is it not going to work? Like these RNA viruses want to, their hardiness is not individual. They're individually very weak. Their hardiness is the ability to like make a lot of themselves and spread in some dangerous ways.
Perfect. Yes, absolutely. And I also want to highlight something that Dr. Ron told me very early on, which is like UV rays, the sun that's like was in my face earlier, is very much the poor man's disinfectant, right? Which is why Walker mentioned like the big sunny area where we have like inventory. It's a lot of windows, it's a lot of light. So the sun is a very powerful disinfectant. It's a very powerful bleaching agent. You know, it's a poor man's disinfectant. So keep that in mind too, in terms of like what's possible going forward.
But does take a lot of time with the amount of it's not, that's more part of your like kind of passive approaches.
Yes.
Not like just put something out. So because of what I just said, I don't want to get people confused with that. Like I have a home UV device that I'm using too. And I mean, it's not a big deal. It uses UVC though, but that's like 30 minutes of UVC. And for sunlight, you need a lot more time. But if it's leaving something out in the sun for a day, for some time, will inactivate a lot of virus. Just leave it at that.
Yes, Perfect. All right. Thank you so much. We're going to keep it pushing. There's still some stuff to cover before we get into question and answers. So what is active decontamination? Walker already walked us through this. That's essentially, for our purposes, is going to be soap or bleach mix, right? And here's the breakdown of what we've been doing so far. Tim, Kylie, Walker, feel free to like jump in if I missed anything on that. But folks, take a screenshot of that, take a picture of that, whatever you need.
Hey, Wendy, I will hop in to say we've gotten into a rhythm where we try not to be wasteful when stuff comes in, be it donations, be it food stocks, or you know, the stock deliveries that we get. But at the same time, we're not afraid to say, you know what, we can't vouch for that. We're going to set it aside. And you have to set your own level there and what you're willing to accept as far as risk. As Dr. Ron pointed out, we're very much risk averse, but we are running a very strict program. So you have to kind of make those decisions. But I would also say when you're dealing with vulnerable people, don't be afraid to say, I don't feel comfortable sending this out, and feel like the urgency is overriding your better judgment.
Yes. Thank you so much for that. All right. Passive decontamination, which we have already touched on and alluded to, are going to be things like mail, right? You can't necessarily dip that in a bleach or like dip that into soap. And this obviously has implications for your own home, right? And for organizing, which we will get to in a little bit, hopefully. Or like very early on in this process, we got like loose rolls of toilet paper. We can't do anything with that, right? But like put it aside and just let it do its thing. That's kind of like the beauty of this thing, is like the knowledge moves you to like what's possible and what you can accept, and you need to adapt to that. All right, y'all have covered a lot of this, thankfully. So yeah, patience is the name of the game for a lot of the passive decontamination side of this. Awesome. The beauty about it too is that like it's not mobile, right? It has no motility. Once it's on the surface, it's not going to breathe on you, or it's not going to come at you, right? So that's kind of like that's the silver lining in that respect, that you can just leave it alone, don't mess with it, don't touch it, and it'll eventually, you know, the risk will be lowered. Let's see. All right. All right, so we're gonna put it all together now. What happens when folks come in a shift? They go to this, and we're gonna try to do this just really briefly. They have a hat on when they come to the second door. Then they have a mask on, right? A properly fitted mask with as much of a CO as possible. And then they come into that S area where we keep all our safety equipment, and they put on their gloves properly.
Wendy?
Yes.
Kathleen was asking, does passive decontamination mean that you just let it decontaminate itself with time?
Yep.
Okay.
Cool. Do you want to take anything else from there? Do you want to take it away, Tim, Kylie, on that end? Like folks come in, they come in, they have their mask, they've washed their hands, they're going to put their gloves on, they're ready to work. Take us through that really quickly. What happens?
Yeah, I can take that. And is this for when inventory is coming in, or is this for drivers?
Please. Yeah, for inventory.
Okay. All right. So when someone comes in for inventory, the first thing they're going to do is they're going to go to our sink. They're going to wash their hands, let them air dry, and then we're going to slip on some gloves. And then Wendy already mentioned hat on, hair up. Also, my internet's really bad right now, so let me know if I start cutting out here. So once we're gloved up and ready, one person takes clean room, everyone else, someone doing admin, then someone in inventory. And then we go through usually the sanitation process for inventory and intaking stuff right away, and then we start fulfilling orders after that.
Yes. So take us through the clean room, if you will, please.
The what? I'm sorry.
The clean room.
Sorry, my internet's cutting out. Can I pass this off to someone?
Yeah, I could take it from here. The clean room. So everything that goes in the clean room must be clean, right? That's everything in the clean room must be clean, and folks have alluded to this earlier. You can decontaminate the things, right, that you're going to put in the clean room, wiping them down, or submerging them in bleach, as folks have already said. Please don't be on your phone, ideally. Your phone's really dirty, so don't take it into the room. You know, that's usually a good practice. And when in doubt, like wipe it down or submerge it, right? And this should be done in terms of like wiping everything down, not just the clean room, but like everything or hot inside staging inventory. All that stuff should be wiped down at the beginning of the shift and at the end of the shift, right? Alrighty. All right, packaging and delivery. Walker did a lot of this already. Especially, yeah.
Can we answer Kathleen's question from the chat, asking if it'd be better to put stuff in a paper bag to store and wait to for it to passively decontaminate rather than a plastic bag? Is there a better option of those two, or does it matter?
I don't think we're putting things in bags. We're just
no need for a bag. Great.
No need for a bag. Yeah.
I agree with that. Just waiting the right amount of time based on the surface characteristics. And if I can show the data on which those surface characteristic things were based on, if there's interest at the end.
Yes, that's fantastic. All right. Yeah, so Walker already talked about this, and this is kind of like a modified surgical technique thing that happens, which is like the clean person has packaged the things in the clean room, right? Which you see like the little plastic baggies. They're ready to go, right? And then there's a hot person, and it's difficult to do it remotely. Like the other part of this training usually is in person, so I just want to let you folks know that. And so pretend that this is the clean hand, right? The clean hand goes with the plastic baggie. The hot person on the other side holds the bag open, right? Try to use your imagination. And then the plastic baggie gets put in there, right? Without touching anything else, like the handles or the bag or the paper bag, right? It's just a drop. And then the person receiving it, the hot person, right, on the outside is gonna go ahead and staple that and put a work order or whatever it is, right? And that's ready to go out. Does that make sense to folks? I know it's difficult, like in a remote scenario, and I'm quarantining, so there's not like another person that I could showcase this with. Do we have a question or anything? Okay. Can someone on our team walk us through the delivery aspect of this? We're following the same protocol for delivery, whether it's an immunocompromised person or it's not an immunocompromised person. And what happens is a little dance. So if any folks on my team want to take that piece of it.
Vanessa is asking in the chat if everything in the clean room is in a plastic bag.
No.
I can answer that if you want. No, but before anything leaves the clean room, it goes into a plastic bag. So within the clean room, it is put in a plastic bag by the clean person in the clean room, and then the plastic bag is put directly inside of the paper bag without anyone else touching that plastic bag and without that person touching that paper bag, basically, so as not to cross-contaminate. I know it's a little confusing to conceptualize it.
Yeah.
Let's see.
Is that, yeah, go for it, Tamer.
You want me to talk about the delivery process of actually dropping off the goods?
Yes, please.
Cool. So what happens at the office is the drivers will show up. We run 2 shifts a day. Generally, drivers get there for the first shift between like 12 and 1, second shift between 2 and 3. The drivers show up, they knock on the door. They don't come in until we tell them to come in. First thing they do is wash their hands. They are wearing a mask. They are wearing a hat. So they're sort of using the same like dress and protocols that we're using in the inventory office. We give them a large plastic bin that's been sanitized before we load the paper bags in there. load it into their car, and then they are in contact with the person that will be receiving the delivery. When they get there, what they do is they get their bin out of the car, they get the bags out of the bin, and they rip open the paper bags, and then they step back 6 feet. The person who's picking up the goods generally brings their own reusable bags with them, or if they want to just like try and carry it in their arms, they're free to do so. But they pull all of the stuff out that's all in individual plastic bags. And we use 2-gallon plastic bags. So it's not like it's one can in one bag. You know, there's 5 or 6 cans in a bag, produce, like a decent amount of stuff, but not so much to be onerous or too heavy for someone to pick up. The person, once they've gotten their stuff, they go back into their home, step back as far as they need. If they're like, you know, not in front of the home. Sometimes we're delivering to apartment buildings and dropping off in a courtyard. Sometimes it's right at the front door. Depends where the recipient is. This is very much a meet people where they're at situation. Then the driver is going to collect all those paper bags, get the bin back, and generally throw out the paper bags before they come to the office or bring those back and we toss them out. But basically, the last person who touched any of the goods that the recipient is touching is the clean room person. So the hot room person, even their hands have been sanitized and they've been soaking in bleach all day, they're not going to touch any of the goods. Once it leaves the clean room, it's really not touched by anyone until it's touched by the person ultimately receiving the goods to avoid as much cross-contamination as possible.
Does that make sense to folks? Thank you, Tim. I know it's hard to conceptualize. To recap, it's a dance, right? So let's say this is the paper bag, right? I'm coming up to the door, I'm dropping it, the person's over here, dropping it and going back. And it's a dance, there's the distance, right? So it should be coordinated, right? To just minimize any risk that might happen. Cool, we can move on. Fantastic. All righty. All right, folks, we made it. We have reached the question and answer portion of this workshop. What's gonna happen is I've taken a look at like your registry, the information that you put when you registered. There's a lot of questions about unhoused neighbors. There's a lot of questions about outreach. We're gonna get to that. A lot of questions about tenants and organizing. We're gonna get to that. Organizing in general, right? Like what's good right now? Should we continue to use paper? Should we lean in on the digital? And remotely, right? There's some questions around that. And then there's also some questions about like distribution of mutual aid money. We're gonna get into that. And then we covered this a little bit, but there's also a possible protocol for clothing donations. If that's your jam, that's what you wanna do, we can get into that. So just wanna let folks know. So I'm gonna stop the share and I'm gonna take a look at the list now. So we can answer your questions directly. Woo! Sorry, y'all, the sun is in my face. Okay.
There was a question in the chat about if we have a protocol for the delivery driver's vehicle. That's a great question. One thing I'll mention that we do is we use big plastic bins for the delivery drivers. So all of the delivery packages are put into the bins in the office, and those are regularly cleaned at the office, obviously. And then when drivers come, they're picking up that bin and putting that bin into their car. So that's part of it. I don't know if there's other protocols we have for drivers, if anybody wants to.
Yeah, I'll tag on to the end of that. We give every driver a bottle of hand sanitizer for their own hands and also a paper towel so that they can use the hand sanitizer to wipe down their steering wheel, the handle of their door, their manual stick shift if they're driving a manual. But we don't ask a driver to like bleach their entire car. That's what the bins and the paper bags are for. We're creating layers between any possible contamination. Because again, the COVID's not gonna like sneak into a paper bag. Like if the COVID's in the car and we've got 2 layers of barriers between the COVID and the goods, the COVID's not going to infect the goods.
Yes, thank you, fantastic. Okay, so first up, what to do not only in terms of prevention, this is a medical question. I feel like we've covered that quite a bit, but also if someone is sick. So I will let Dr. Ram take that.
As in if a driver's sick?
This is a question from Ara.
Yeah, let me answer your exact question.
You want to jump in, Ara?
How did you get the question? Was it in the chat?
No, these are the things that folks inputted when they registered for this workshop.
Oh.
Okay. Is Ara on here? Okay.
I don't think she's on with us.
Well,
Okay.
well, I can just riff and I mean.
Yeah, go for it.
I mean, sick means more virus particles, more risk for everybody involved. So, I mean, you know, the people who are doing this, by the way, like my hat is so off to you, and you are amazing, and yet martyrdom is not what's being called for in any of this, right? So that if you are sick, what you should be doing is get yourself better and take a break from doing work like this. And then I guess there's the question about like, maybe as well, okay, well, what if a client is sick or a person you're trying to help? Well, obviously those are some people who need help. And that's where the idea of the kind of universal precaution approach comes in, I think, right? Which is that you don't know. And so maybe kind of assume that people are sick, that you're helping, and you have really good distancing. You know, Wendy's just, you know, and the other like good distancing protocol. So I guess that's my answer.
All right. The dogs are going crazy with the mailman, so pardon the noise.
We have
The
a couple
next,
in the chat too. Can I bring those up now, or do you want to wait?
can we wait on those? I want to, yeah, awesome. Anything, so another one is like, how do we protect our unhoused neighbors, right, during outreach? Harley, honey. So we can learn enough to share information. So just general tips on outreach to our unhoused folks. If anyone on the team wants to jump in.
I can speak a little bit to the outreach process. I mean, they take a lot of the same protections that you would take in normal lives. You know, wearing a mask. They do tend to wear gloves. There are other health concerns around doing encampment outreach in the city, mainly because our city has just failed so spectacularly to provide any kind of like hygiene. But aside from that, it's not supremely different from what LASA outreach looked like before the pandemic. There is more focus on getting people hygiene and health and hand sanitizers and masks so that they can use it. But, you know, it's not like our outreach team goes out there wearing like, you know, the Tyvek suits and booties and like wearing hazmat suits. They're still very much operating in the world, but taking extra precautions, but also understanding that doing outreach work in the city of Los Angeles is always dangerous. Like, Reverend Andy Bales lost a leg just working on Skid Row. So they just have to take extra precautions anyways, even before COVID.
I think reasonable distance is a huge, just like distance is very powerful. And of course not super distance, because then you're not actually helping the person, but just like putting some feet, an air cushion between you and the person, that is, and yet, you know, of course, like trying to show the warmth and compassion that is undermined by that distance would be my answer.
Yeah.
If I can add one thing that is really crucial and is different about outreach to encampments is there has to be a larger education piece. So what's happening for unhoused folks is they have a very severe limitation in terms of what kind of information they're getting about what's going on. So it's definitely a huge part of it is letting these people know exactly what is going on, what is the latest on the outbreak itself, and also what the city is or isn't doing, what kind of services are available. Those are really crucial pieces for this. And like, as we talked about before, for like continuity and longevity of the project, right? Consistency is important. And part of that is letting them know where they will be able to access things like a hand washing station or a shower, or what potential there is for them to get into some sort of shelter. That stuff is really crucial, and is completely interlinked with infection control.
Yeah, absolutely. We can't underestimate, access to soap and water, right? Like bathrooms. And something that we've been doing down at the border has been to provide those hand washing stations. There's a lot of similarities with like, our refugee family and our unhoused family. They're facing a lot of the same things. So like, if we need to build some hand washing stations, then that's what we're doing, right? We're building hand washing stations. We're making soap available to folks.
Right. And also information. Here, what we saw in Los Angeles was that our unhoused folks didn't even know that there was a pandemic, that there was an outbreak until they were being like met by volunteers offering outreach. We have a question specifically about serving houseless folks. Natalie, do you want to ask that now?
Yeah, thanks. Something that we're coming up into, so first we're still serving food, like hot food and cold food directly, and it's like onto paper plates. And I'm wondering, well, that's a different question. In that practice, and just in distributing goods, the volunteers, there's not exactly 6 feet between the volunteers and the people that are living outside. And there was a lot of, there were some rumbles that happened the first few weeks because the houseless folks didn't understand the 6 feet. And then some volunteers felt violated. And also there was like this conversation of like, these people are living like in very unsanitary ways, and we have masks on and we are serving them. We can't expect everyone to keep 6 feet away from us because that's not how they're living. And so how do we like balance safety with also like acknowledging that people are living in really unsanitary conditions? And just for these few moments while they get food from us, they might not understand that we prefer 6 feet or it's necessary.
Yeah, you're bringing up something that is totally incredibly difficult, and that has been part of our experience as well. I know it's been part of my personal experience. It's a very difficult thing to balance. I'll say for myself, I don't have a good answer to that. We're all navigating this as best as we can. And this is a great example of like how we need to have, community talk about what are the best ways to approach this. Like, and again, like this is also going to be something like on a case-by-case situation. I know I've had different experiences around that exact thing, right? Like where I've had the experience where I say to somebody like, we're worried about COVID, so like, can we keep a distance? And that's fine. And I've had experiences where it's not. And I've had experiences where that person can't hear me at all for whatever reason, right? So this is part of the, the ongoing difficulty of outreach work in general. And I think it's important that we continue talking about it and get new ideas and get new concepts. And I don't know. That's my non-answer.
Yeah, Ron, go for it.
Let's see.
Wait, there you go.
Yeah, I'm sorry. So some amazing points that people are making here. And like, one is information about this is like disseminates in like radically different rates to different people getting information from different sources, including, exactly as Kendall said, people who aren't aware that anything is going on. And then certainly, even if you kind of like unpack like a lot of like the politics, you can see like their information sources like slant stuff in certain ways and other ways. And then, so all of this, one thing that I think all this type of work requires is trying hard to get out of your own head and into the heads of other people by listening and understanding where they are, and being like asking questions instead of telling, like, well, what do you understand about all this, and what do you get? And then, yes, in some cases, educating and learning, both. So the other thing is true is that many of the basic human things that we do to show care to people, the handshake, smile, the touch at the right instance, and many of those things are upended by all this, right? I mean, it's sort of like one of the cruelties of all this, so that you're looking to show that kind of compassion and connection in other ways, even, but ultimately, like, you're trying to help the person and not necessarily, it's not as important to make them your friend for life as it is to help them, too. And so that means some people will be like put off by something or other. And then they'll also may not understand because person X does this, but person Y doesn't, who also cares. And so you're being extra cautious and a little distanced. And then, so that sort of getting out of one's own head and being where that person is, and is, I think, a broad answer to this.
Yeah, and if I can add to that, something that Bill, who some people noticed walked by in my kitchen, just mentioned too, is that, to go back to what mutual aid is, right? Mutual aid is about us helping each other. It's not about charity. It's about building community relationships. So by, having a moment with somebody where you say, I need you to stand further back from me, it's a way for you to offer them an opportunity to help you with something that you need in that moment. And so by bringing the focus to yourself, that's, at least for me, that's been the most effective mechanism for me, is for me to say, I'm concerned about my health. So if you could please stay further away from me, this is something that I need for me. That, helps to orient it around like you asking for something that somebody can help you with, which is generally an easier way into that conversation. Vlad is saying, my experience is that most people understand when I ask to practice distancing techniques. When I see someone approaching quickly, I've had success by asking for help to keep everyone safe. Hey, brother, sister, can you please allow me to bring supplies to you? It's important to keep everyone safe from the virus. Okay, if it's cool with Wendy, I have another really great question from the chat that I wanted to bring up from Charisse Song. She said, it's really awesome to hear how carefully you guys are doing things. I feel less like Chicken Little in my organizing circles. Shout out to Wendy, who was our Chicken Little in the beginning. How did you all agree on these practices, and was or is it hard to get comrades to buy in? What happens if a comrade or volunteer is less careful? I'm also wondering if you guys have comrades supporting remotely, and such as those of us with health risk factors, what kind of roles can comrades do to support you from home? I'll take the second part of that real quick. There's tons of ways that people are helping us remotely. It's enormously important. Delivering this kind of aid requires like a ton of back-end work. So every person who submits to our form, we reach out to them before we go into this process. So that means phone calls. So we have a lot of people working from home on that. And also remotely, like was mentioned before, the needs team is all remote work. Setting up the deliveries is all remote. We have an enormous need here in Los Angeles for language justice. So we have folks doing interpretation and translation for us. That's remote work. We're doing cash transfers to people. That's all done remotely. That again requires a phone call to assess need. We'll get into this probably a little bit later, but part of that is us asking people if they intend to use that money to pay rent. And if that is their intention, we talk to them about organizing and about why going on rent strike is probably the best option, and hanging on to their money for actual vital needs as opposed to property theft via rent is more important, right? So there's a ton of back-end support stuff and not to mention digital, making graphics, getting the word out, communication. There's a ton of remote stuff. And then Wendy, do you want to take the first part of that question?
I'd like to hop on it too.
Yeah,
Go for it, Walker.
go for it, Walker.
Yeah.
All right. Wendy, did you want to jump in?
Go for it.
All right, cool. So the first part of that question was like, how do we get buy-in from our comrades? I think in Ground Game's case, a lot of the people who are like part of this project have been around for a while with the org, and so we're all familiar with working with each other, and it's generally been like a horizontal collaborative space for the most part. But then we also have like amazing people who've come in the door and gotten involved in one way or another, or in like various campaigns that Ground Game's been involved in, like Wendy, like Kylie, like all these other amazing people. And then a lot of us just know how to shut the hell up and like defer to people who have some expertise. So like, who's done mutual aid work before? Who's done their reading on the theory and philosophy and the implementation of it? Who is a healthcare worker and has like had to work in highly stressful situations containing infection? We just leaned into each other's trust and experience, and we built a respectful culture around that. Not always perfect, and we have had to have some like tough conversations and work through those, but like we came to this process knowing that we were in it for better or for worse, and we were going to hold each other through it. And then to speak to like, how did we get everyone to agree on decon in the inventory team? I don't know if you've met Wendy, but Wendy does not like to repeat. She is a very forceful personality, and that's because she's confident and she knows what the fuck she's talking about. So like, it makes it very easy to trust her.
I just work here.
But I mean, I gravitate, like, we recognize what needs were, we recognized the vision we had for getting things done, and then people kind of self-selected based on their experiences and their expertise, and we all just trusted each other to come to that. And where we needed to have like horizontal conversations, like no one on our team, whether or not it's my preference that everyone in our operation works mandatory one shift on inventory to see what like the constraints are. It's not a thing that's happened. But all the same, I totally respect it when needs, or when admin, or when anyone else has like a pointed question about our process and needs to understand how we're doing a thing so that they can better their processes. So we just have very frank conversations about ways that we can streamline efficiency, things that don't go right, things that could be done better, where we think other teams could jump in. And like how I found inventory, one, Jessica Stalins just told me I was doing it, and I shrugged and said, okay. And also I've worked in a ton of pizza shops, and like, I don't know if you've ever worked in a pizza shop, but our inventory office is like inventory intake, prep, stocking, delivery packaging, and then it's out the door. Like, I know how to do that. And then Wendy's expertise added the decon. So it really is just like a collaborative environment. It's not without its frustrations, but like that spirit of all of us working together, it's honestly a more fulfilling place for me right now than my day job in organizing. So
Beautifully put.
No shade to Food and Water Watch.
None.
Yeah. So in the interest of time, I'm going to keep us moving along. Walker, that was beautifully put. I would only add that, like, from my experience, folks didn't come to the door with ego, and there was already like trust and collaboration there to begin with. So that was really beautiful. Those are like two of the main things that like worked for me. I'm going to get back to this list because I really want to answer folks' questions that they came in with. A lot of this we already answered.
Okay, if you have a question in the chat, Maybe you can put it in the chat, and some of us who are on the sidelines can answer it in the chat while Wendy's answering these other questions.
Yes.
So pop those in there.
Perfect. There's a question about like money, how to collect online donations. I'm not sure, like, what does that mean? We will probably have to get offline with you. That's Nancy. There's also another question about like delivering checks to folks and like having them sign. Social distance, and also like we went over in terms of like the mail thing, that's got to be implemented too. Get with me on the details if you want, but essentially it's a passive decontamination process, right? As best as possible, right? But really I would say like go digital, like start doing direct deposit, start doing mobile deposit, like go digital, right? And I know that sometimes for a lot of folks that's not going to be possible, right? In terms of tenants and how to organize with tenants, what I've recommended is knock on the door or announce yourself, but tell them not to open the door, right? That's been my recommendation. Let the door in place, right? And like explain yourself really quickly. I've done some canvassing. I'm okay with it, right? But canvassing comes useful in these scenarios because you can knock on the door and then you need to back away, right? So if it's like a house, right? If it's an apartment, you don't necessarily have that luxury. So you need to have a really quick learning curve about like knocking on the door, getting away and just being like, hey, really, like it's your neighbor, but don't open the door or something to that effect, right? You're gonna find like your own way of doing it. That's what I would recommend. And try to get information and details right then and there, right then and there. Why? Because if you give people paper, that potentially has the virus, right? Doc Tim has said this, Doc Ron has said this, asymptomatic. Folks are walking around with COVID asymptomatic, right? So me right now, I feel great, I feel fantastic, I'm talking with y'all. If I go get the test tomorrow, I could have a positive test, right? I could have a positive COVID test and be asymptomatic, right? So you need to wear a mask, right? Gloves are not absolutely necessary. Just wash your hands well before and after and as much as possible, right? And try to stay away from paper, try to stay away from paper. If you must, you know, make sure you're handling it properly with some of the fundamentals that we've talked about here today. We've talked about outreach, how to protect the communities we're seeking to support. Here we go. Someone here, that's more of a general question. I'm gonna skip that. Yeah, so best practices for organizing volunteers, delivering checks, receiving signatures. I've addressed that. We've talked a little bit about keeping people safe while also respecting their own right to make choices for themselves, especially when serving the unhoused community. Someone put in the chat, like, be direct, right? Like, it's kind of like a psychological thing too, like set out your boundaries, right? That's worked for me. Where I'm just like, hey man, just could we just keep 6 feet, like for my own safety? Make it about you, right? If you need to. We have talked about how can someone who is immunocompromised still have an impact with mutual aid and organizing efforts. Remote, right? There's a ton of work that needs to happen remote. There's a ton of behind the scenes that happened before any of our first delivery went out, like a ton of work. How to give real world guidance on infection control to staff I oversee in homeless and unhoused shelters and supportive housing. Who is that? That is Emmett. Are you on this call? Okay. I think we've talked some about that. Does anybody want to chime in on that? Infection control staff, oversee. Okay, we've talked about it some. I don't think they're on this call. Oh, this is good. This is a medical question. Safety standards for people living in households with high-risk members, type 1 diabetes, in high prevalence areas. Dr. Ron, do you want to take this?
Yeah, sorry. Yeah. Well, that I guess that's one of the things I was saying, which is like any house could have that, and not everybody. like, so that therefore you should probably think like every house has that.
Yes.
Every house has a 90-year-old. Every house has a diabetic person with diabetes who is vulnerable. And then so that you think the very healthy looking person that I'm interacting with at the door, they're going to be the conduit of COVID to that person who I can't see. So that if you take that stance from the beginning with everybody, then I think you can serve everybody. In other words, I would, there's nobody who I would say you can't help them because you have enough in your control to protect people.
Yeah.
Like in other words, Wendy has done an incredible job with this, right? But don't let that intimidate you in a certain way, which is like it has to be like, this level of excellence that is
and
so
don't feel bad
high that you just won't do stuff.
We all have to practice not being intimidated by Wendy every day.
Well, but actually, what I will also say is that Wendy's expertise and knowledge comes from experience, doing homework and checking with others, of which I was just one person. So that's where that comes from, not from but anyhow, I don't think there's any situation, there's a lot of high risk situations out there. So orient yourself towards protecting that high risk person everywhere you go.
Yes. If you take anything away from this, it's that, right? Like, and organizing just generally, thank you, Dr. Ron, is the curb cut effect. Google that, right? And organizing, I think a lot of folks on this call come from organizing. When you center the most vulnerable, when you center the most marginalized and the most oppressed, everybody wins. Literally, like this, literally, I'm not making this up. And you see this in urban planning, you see this in public health, you see this in a variety of fields, right? So when you cater to that, when you operate with that, everybody wins, right? So beautifully put. Thank you so much, Dr. Ron. I'm going to keep it moving to something that's particularly important to me, which is how to reduce the risk of transmission during mass releases of immigrants from detention, transportation, and organizing emergency housing. Do folks want to chime in with experience? If you've done this already, what's worked for you?
Hi, folks. This is Ken Montenegro from the National Lawyers Guild, and I'm in Jackson Heights, New York. So in one of the epicenters, it's really horrible here. But what I'll say is that to that question, what folks have been doing is folks have been looking for extra free apartments. So like for people who have left the city, that's been one source of a couple. For other folks, it's been renting rooms, which is such a short-term and expensive solution. It's not even a solution. It's a Band-Aid on a gaping wound. So those are short-term things. And I think that's one of the areas where like the good work folks are doing in LA and across the country about reclaiming hotels probably has a nexus with this. And when this is over, making sure that we like work towards better reentry programs, because those are garbage right now.
Yeah, to speak to that, to build on that a little bit, I would say like the number one thing is the education piece, right? Like the best thing that you can do is get the population that you're working with to understand and be practicing the things that we've all been practicing, right? So that's part of where it begins. And then the other thing is that this is a time for us who have been doing this work for a long time and calling for these massive structural overhauls to not even an ounce of compromise around this stuff. If the things that we have been working towards had been put in place, we would all be in a much better situation right now. And that cannot be erased. So it's really a time for us to stand on the work that we've done and the credibility we've built around saying we need to get people out of prisons. We need to have housing for everybody. We need to have these things as a baseline. And we have been calling for that. So it's time for us to say we have the credibility here. We have been asking for these things. We have been asking for a rent raise. We've been asking for all of these things. So we should be trusted, and we have to use this time to implement those policy changes, like many of us are working on, right? So that this stuff does not happen again, and understanding that this is just highlighting the inequities. Like COVID is just one example of the ways that people are impacted by these things. And it's just illuminating the deep problems in our system. Those can be changed, and they will be changed. So we have to have the confidence, like, all this confidence that Wendy brings from this experience around like infection protocol. We all have that around our ideas, our policies, our vision. So hold on to that tight and stand strong in that.
Yes. I want to, Paula, that's a question from Paula. Paula, please, let's get offline. I need to think that through. I would love to meet with you and or chat with you, whatever, and think that through. Some of these things, it's just like, it's a collaborative effort, right? It's like you telling me, okay, like we do this and then we do this and like this is what's possible, and then I'm able to be like, oh, okay, yeah, you need to do this and then you need to do this, right? Or like make recommendations, right? Obviously, I'm not here to tell anybody what to do, but a lot of these things are procedural, so it helps a lot to just meet you where you're at. So these are all really great points. Now we can get to the chat questions really quickly. We have about 5 minutes left. I'm so sorry, folks.
We've got B and Stack. And then we have a couple of questions we haven't gotten to yet, which we will either answer here or we will answer offline.
Yes. If your question does not get answered, like email me, email Mutual Aid LA. We will figure it out. We will figure it out together.
Okay, B, do you want to go ahead?
Yeah, so to actually continue the conversation about thinking of solutions for housing, working with the tenants union is making it obvious that landlords are not evicting people. They're still finding ways to do it, so like homelessness is a thing, getting folks out of facilities is a thing. And I was actually just having a conversation with a member of the South Central local about finding ways to connect people who have resources to people who need them, and just circumvent like waiting for the government and waiting for the city to do that, and like actually just like doing it autonomously and putting that as well under the umbrella of mutual aid, because that's what it is. It's still like the exchange of resources, the funneling of resources to people who need them and people who don't. But so I have a pet care cooperative. That's where I actually met Kendall in a co-op workshop that was put on by the LA Co-op Lab. And they, I think co-ops are a big answer to this question of like, what is the new normal going to be? Because it can't be what it was, right? So like, if we had cooperative worker setups, if we had cooperative housing, if we had cooperative farming, things like that, things where people matter, having the workers and the owners in the same position would make the whole situation look different, right? So one of the things that I want to do, I have a pet care co-op. We're in South Central. We have clients like throughout LA now, which is cool, but a lot of them have money. A lot of them are still working. A lot of them have extra like additional dwelling units and Airbnb units that are not going to any use because they're either just sitting there or, as storage or something. So I'm trying to think of ways to like use, not use necessarily my co-op as a vehicle, but at least like part of a collaboration among organizations to say like, we can do this on our own. How do we make it at least a sort of intentional and structured thing that we do, so that like folks who feel uneasy about making their property and their belongings available to like strangers essentially, right? But like maybe we can find people within our networks who can model that firsthand. I would love to talk to anybody else about that offline, but that's just an idea. I think that we should start pushing, like, let's do this autonomously. We can't wait. Obviously, these governors and these mayors don't have a motivation to do what the hell is right. And these people are literally putting their populations that put the entire population at risk, and people don't seem to understand that. Like people are coming back out of jail into regular life, and then y'all want to open up the businesses again. So like nobody seems to really get the imperative around that. And I think modeling it autonomously and having to go around the government might just be a way we have to do it.
Yeah, wonderful. Okay, folks, let's definitely get offline with that. B, reach out. If you would like to collaborate with B, like reach out in the chat. Folks have dropped their contacts. Feel free to reach out. If you also like want to answer questions or are a resource, drop it in the chat. We will send.
Wendy,
Yeah.
so just I want to say specifically, Vanessa, John, and Clayton all had questions that we didn't get a chance to get to. So please, if y'all had a question, reach out to us. Let's figure it out. We will resource you, etc.
Yes, we will figure it out together. Beautiful. So yeah, let's get all that info in the chat for folks. We will be sending the recording so you can make it available to your networks and your friends. If it's interested to folks, we can also include the transcript of this. So like you have folks' info if that's something that's of interest to you. I'm so sorry we did not get to everybody's questions. There's so much to cover, so much to do. Yeah, thank you so much for being here. Thank you so much for your work. With that, I will leave it. And we take care of us. We got us. So namaste. Peace be with you. Light be with you. And yeah, we take care of us, baby. Fist up. Take care, y'all. Be good.